recent years, systematic reviews have become one of the most popular types of literature reviews in the biomedical field. Because they don't require patient recruitment or ethical approval, many consider systematic reviews to be a more accessible form of research that can still have a major impact on both practice guidelines and patients. However, this belief in systematic reviews' perceived simplicity is not fully accurate, and many of the articles that are published as systematic reviews do not actually meet the criteria. So, what is a systematic review? According to the Cochrane Handbook of Systematic Reviews, a systematic review is a review that seeks to collate evidence that fits pre-specified eligibility criteria in order to answer a specific research question. In other words, a systematic review attempts to collect and analyze all papers written that answer a specific research question. Researchers find and select these papers based on specified inclusion criteria. They also aim to minimize bias by explicitly documenting the methods used in conducting the review, ideally through both a protocol written before the review begins and the inclusion of a reproducible search strategy in the manuscript itself. According to Cochrane, if a review does not have these two characteristics, then it is not a systematic review. That said, Cochrane is only one of many systematic review methodologies, and there are no standardized universal guidelines for systematic reviews. However, high-quality systematic reviews do share some common characteristics, including a specific research question along with clearly stated objectives for the review and predefined inclusion and exclusion criteria for the studies, a reproducible comprehensive search strategy, a meta-analysis of the selected papers. So, how does one properly prepare for a systematic review? First of all, keep in mind that systematic reviews are based around very specific questions, generally stated in PICO format. For example, a good systematic review question might be along the lines of, does a specific medication cause a specific side effect when treating a specific condition? If your question is broader, for example, what are the side effects of using a specific medication when treating a specific condition? A different type of literature review, such as a narrative or integrative review, may be more appropriate. A quality systematic review should also have a protocol completed beforehand, which includes the question, specific inclusion and exclusion criteria, methods for assessing bias, and methods for the meta-analysis. True systematic reviews should also not have date or language limitations, as you should be trying to find everything out there that answers your question. Quality systematic reviews also require a reproducible complex search strategy repeated across multiple databases. Depending on the research question, the number of results for a systematic review can easily be in the thousands or tens of thousands. Systematic reviews also require a team. While less rigorous literature reviews can be completed by one person, systematic reviews require at least 2 people to review the search results, with a third to resolve any disputes. Many methodologies recommend teams of 5 or more people. As noted, the search strategy used in a systematic review needs to be reproducible, meaning that those reading the review can reperform the search themselves and get the same results. This means that systematic reviews should contain all of the search strings exactly as they were entered into each database. Because complex search strings can be long and the string should be entered into multiple databases, meaning that it has to be formatted for each database, this information will often be added on as supplemental material rather than taking up space in the paper. This is acceptable. The information just needs to be readily available. The final and perhaps most major characteristic of a systematic review that differentiates it from other types of literature reviews is the meta-analysis. In this portion of the review, data fitting the pre-specified criteria is pooled and statistically analyzed. If you are not prepared to do this and do not have a statistician on your team who can, it may be best to consider a different type of review. As one can imagine, due to both the detail that goes into a systematic review and the number of people that should be involved, a proper systematic review will also take a good deal of time. It is common for quality systematic reviews to take a year or more to complete. If you need to complete a literature review within a short period of time, a rapid review may better fit your needs. If you're not sure about whether your research question would be appropriate for a systematic review, consider the following questions, taken from the Mayo Clinic Library's blog. Do I have a clearly defined clinical question with established inclusion and exclusion criteria? Do I have a team of at least 3 people assembled? Do I have time to go through as many search results as we might find? Do I have resources to get foreign language articles appropriately translated? Do I have the statistical resources to analyze and pool data? If your answer to any of these questions is no, it may be more appropriate to conduct a different type of literature review. If you have any additional questions or want to reach out to the library about assistance with a systematic review, please feel free to contact us via the Ask a Question form on our website.